EMR back office workflow. In this video, we're going to walk through the typical workflow of the back office. Now, we're not going to go into a lot of detail with these features. The intent here is more of an overview or an outline of the steps that must be accomplished. So make sure you check out the individual videos here on the Resource Center if you need the function level detail. As regards the user profile setup for back office, typically your users are going to be defined either as medical assistant or clinical staff. Function-wise, this includes your patient intake, such as taking of vitals and chief complaint, reviewing the patient's medical history, their allergies, their current medications, as well as administering vaccines, performing health maintenance tasks, and processing physician orders. And in some cases, it may also include checking out the patient. We're going to go ahead and log into Prognosis. I'm logged in here as my medical assistant, Connor Walsh. Now, before we get started with the workflow, with regards to our user profile setups, again, this could be medical assistants and/or clinical staff, which would include nurses. The basic permissions assigned to these user roles includes all of the clinical access, and in many cases, it may also include basic front office permissions. If your individuals need to have specific rights, make sure you check out the video module, User Profile and Login Credentials. But since I am logged in here as Connor, we're going to go ahead and process our patient Jax Teller. You can see here on my home page that Jax has already arrived and is here for a right wrist injury. So as I'm taking Jax back to the room to take his vitals and start the intake, I've noticed that the icon next to his name is showing in a bright red. That bright red indicates that the practice is using the patient intake forms on the portal, and the patient has completed his paperwork online. During the intake, then, I will verify that data to update it to the chart. Now, if you do not use the patient portal, you will not have that part of your intake. The icon will show in the yellow, and you won't need to worry about this step. So as I open Jack's chart, initially here I'm getting prompted that there are health maintenance tests due as well as vaccinations. Now, these alerts are only going to appear when applicable. So part of Jack's visit today, I will administer these as his clinician. But for now, I'm just going to click OK, and we're going to open up that patient form here on the left so that we can verify the data that he populated online on the portal. Now, the content of these forms can vary whether it's a new or an existing patient. This is entirely locally defined. Our patient Jax is an existing patient, and what he has updated today, I see here that there are allergies. He's also updated his surgical history. So once I verify the information, I'm just going to go ahead and accept it. I could make changes if needed, if the patient had forgotten something. Either way, once I hit accept at this point, notice the confirmation says that the encounter is updated. So now this information is present on my chart. So I'm going to go ahead and complete my intake. Now, because I'm in a clinical workflow, if you look at the bottom of the screen, you will notice I have a green arrow in the lower right called Vitals. Patient form is starting my workflow for the intake. Of course, again, if you don't have the portal, you might start on the Vitals as your first screen. I'm going to go ahead and navigate there to the Vitals. And in my example, you'll notice I now have one to go left to go back to the form. And then I also have arrows going right to continue through the workflow. This workflow, of course, is customized at an encounter type level, at a user level. And that is covered in the defining workflow video here on the Resource Center. My vitals are never pre-populated because that is something that you're going to do on every new visit. And you'll notice that they are straight text fields. So I'm going to just go ahead for the sake of time and enter a couple of the vitals. The height and weight and blood pressure are what is required for meaningful use. So I'm just going to go ahead and enter those for now. And of course, based on your workflow, you could go ahead and gather the additional vitals that you want. Now, I do not have to save individually when I'm inside my workflow. The green arrows will auto-update and also allow me the opportunity of making changes if needed. If I'm not within the workflow arrows, I would have to click the Save button or I would lose my data. So now I'm advancing to the history of present illness or the chief complaint. Now, if you recall from the home page, we noticed the reason Jax made his visit today was for a wrist injury. So I'm going to go ahead and choose my chief complaint there of wrist pain and injury. Now your workflow within the practice may vary. In some cases, it is the clinician who completes this data. In other situations, the physician does it. So if you're in a practice where you, the MA, does it, you could go ahead here and enter the information. We know Jack's hurt his right hand, so I'm going to skip the left and come down here to the right section and indicate the questions. I could enter any comments as needed and then go on to my next square, which I have predefined here as allergies. Now remember, the allergies was something he had documented on the patient form. It is defaulting here. And the way I know it defaulted on his form is that my background color is green, which tells me it was updated as of that encounter. If it was brought forward from history, it would be yellow instead of green. So since I just verified this with him on the form, I don't need to make any more changes here. If it were a brand new patient, or if I were not using the patient form to populate this data, I would add his allergies down here through the transition of care section. In the case of Jack's, I'm just going to navigate on to the current medications. Here you see my current medications are yellow instead of green because that is coming forward from his previous visits. This was not new data as of today. But all of these face sheet squares that we're reviewing in our intake comes from those patient forms if you have them designed that way. Same with past medical history. It's carrying forward. I do not need to update it because the joint hand was something new he had put on his complaint form on the portal. So now that is also reflected as of today's visit. Continuing on, I'm just going to go to the surgical history, family history, social history. And notice I don't have any more arrows at the bottom. For the medical assistance intake, I'm done. Now I'm just going to go ahead and click my face sheet. If this is an existing patient, as Jack's was, you have an option. Instead of going through the workflow as I just demonstrated, screen by screen, you can glance here at the face sheet at all of your squares together. Now notice my check marks are present because I went in there square by square and got credit for reviewing them. If I did not want to use that workflow, I could simply click this little checkbox up here that says check all, which would indicate as of that visit, I have reviewed everything. So that is also going to be a decision within your practice as to the level of the workflow and whether or not on a new patient versus an established patient, you go through all of the screens or if you just do it here at the one place. The back office workflow sometimes is in parts. You do a little bit up front, you change the status so the doctor comes in and sees the patient, the doctor makes his decision, and then you go back in and complete it. So we're going to go ahead and show you how you would do that at this point. You would click the patient workflow here in the upper right, which is our routing status. Notice it says with MA because I am currently with the patient and I am the medical assistant. So if I am done with the first part of my workflow, then I can now change the patient's status to let the doctor know, and I can go on to my next patient. Well, now let's assume that doctor has done his part and I need to go back in there now to finish the visit. So the doctor now can use that same patient workflow status that we just looked at, only this time he's going to say ready for MA or ready for nurse. And then I can go back in there and pick up where I left off with the back office workflow. So I'm back in as myself now. I'm going to go into my vaccinations down here on my face sheet. I see that his adult influenza is overdue. I have two options with administering the vaccine. If you want to simply say that you did it today, then you can go in there and put today's date and click OK, and then that saves it as having been administered. And you see that updated here on the face sheet. Now I'm going to go back in there and show you inside the administer button. By just entering the admin date on the outer screen, I did not enter any of these other details, so they're not present. So if within your practice you do want to include these details, the dosage, the route, the site, the manufacturer, expiration, and so on, and you've not predefined those values in your vaccine master, or maybe you, because of immunization registry under meaningful use, you're required to enter that data, then you would have to actually click the administer button as I just did here, populate all of these fields. Either way, you're going to get credit for administering the vaccine. It's just a matter of if you're going to enter that data or not. Health maintenance behaves the same way. So I see here that Jax is due for a cardiac panel and a thyroid antibody panel. So regardless if it was an automated protocol or an ad hoc data entry, similar to the vaccines, you can either indicate that you've performed the test here directly on the outer cell of the face sheet, or we can go into the health maintenance details button. So in my example for Jax, for the cardiac panel, I'm going to put in today's date, and then I can enter the result if I want to. I also have the health maintenance details here, which, similar to what we saw in the vaccines, if I wanted to go ahead and enter the date I did it and the status and result in here, I can, as well as go ahead then and schedule the next time I want to do it in the frequency. So that's going to be based upon local processes if you need to go to the level of detail or not. If the doctor had ordered labs, radiology, perhaps a prescription, and it's your role now to process those, then of course you could come over here to your lab order, create the lab test, go to your radiology order, create the radiology order, and same thing with your prescription. Now all of those are covered in separate videos here on the Resource Center as far as how to populate these order screens. So I'm not going to cover those here. That is all situational based on your patient's scenario and the workflow as to what the doctor does and what the doctor asks his medical assistants and nurses to do. Then at this point, if you, as part of the back office, do checkout, you could go ahead and check the patient out. Or if you're done and it's the front office workflow then that kicks in to do checkout, I'm going to go back up here to my patient routing or the workflow. And this time I'm going to put ready for checkout. I'm going to go ahead and remove my room number because the patient is done. So now my status is checkout. He's no longer in a room. So if the front office now performs checkout, great. Or if I need to do the checkout, then based on the scenarios, I can go ahead and perform the checkout also. Now the checkout process will vary from one office to another based on different scenarios, such as, are you booking a follow-up appointment? Are you printing walkout documents such as lab requisitions, prescriptions, education that you're giving the client? Are you referring the patient to another doctor and you therefore need to produce a referral letter? And if so, are you getting pre-certification? Maybe it is a surgical procedure, an MRI or something that you are obtaining pre-certification for. Let's say we're going to check Olivia Pope out because we're done. So since she is still the one I have highlighted and selected in my current encounter, if I click the Take Appointment icon up here in my system tray, notice it already defaults to Olivia Pope, to Dr. Cooper at Bayside, because that is the current appointment location and attending doctor. It's assuming that the follow-up is for the same doctor, same location. If that is the case, I don't have to change anything but come in here and click my search link, and that will activate Dr. Cooper's work pattern for that location. I simply click Find. I can say Find Next until I get the available slot that the patient would like, and then I can select that slot, and that will then update my appointment date and time appropriately. Of course, you want to verify that you've got the appropriate encounter type and specify the reason for the visit. That, incidentally, is the third way of creating an appointment I alluded to earlier. When you are working with the current patient, it automatically defaults to that patient for that doctor and that location. Now, let's say you also need to give Olivia a referral because you're referring her out to a specialist. If we go under our Patient tab, we choose the option called Letters Out. Now there is a separate video on this module, of course, on the Resource Center, so I'm not going to go into the details of how to fill this out, but let's say that we're going to just send this to our referring Dr. Isles. We can select our referral template letter. If it is a referral within the context of transitioning of care for meaningful use, we do want to make sure we click this TOC checkbox. We also then want to make sure that we go in and attach our continuity of care document, which is the meaningful use compliance piece for that referral. If we're not interested in meaningful use and we're simply printing a referral letter, we would not need to do that attachment. Now that I've attached my transition of care, I'm going to save it, and then I have my action options up here, whether I want to print it, fax it, email it, or download it to a thumb drive, whichever media you prefer. Now, at the same time you are doing a referral, you may or may not also be bringing the patient back into your practice for an MRI or a procedure that you need to obtain certification for. So again, under our patient tab, we're this time going to go down and choose clinic forms. Notice on the left it defaults to our patient Olivia. We can bring in our authorization tracking form, fill out all of the required data as far as the reason for the referral, when, and so on. If we at the front desk, we're setting it up for our pre-certification department, we can go into the Save Notify. If we have set up a pre-certification distribution list, we can go ahead and choose that distribution list, and it will go to all of the appropriate personnel in that pre-cert department with an attachment to this clinic form. And then the last part of doing a checkout, whether or not you had a referral, whether or not you had a pre-certification, and whether or not you created a follow-up appointment. Maybe you just need to print the documents for today's visit. So again, while she's highlighted here on the home page, you have the Checkout Docs icon. And this will be reflective of all of the documentation that has been accumulating during the visit. So as the doctor and the nurses are treating the patient, doing allergy shots, ordering labs, writing prescriptions, this would give you an opportunity at the front desk in a single click to print all of those documents in one print job and then hand them all to the patient as they are leaving from your front desk. So in a nutshell, that would be your workflow at the front desk.